2 p.m. in Japan, so it starts today's program, the 17th in Asia Telemedicine Symposium, ATS. So, ladies and gentlemen, welcome to CAM, the ATS. I'm Kuriko Kudo from TEMDEC, and I'm very happy to start the ATS. So, we have 2 days program, and today is the engineering workshop. Today is more smaller, like the private meeting within the medical working group. And tomorrow, we will have the main session of ATS and a whole 1-day program. So today, thank you very much for participating on site and online. So in today's engineering workshop, I will make the explanation about the overview of our project. Actually, this engineering workshop is for our new project, development of e-learning program for the doctor-to-doctor international conference or consultation. And we will have the 7 presenters from this topic and have the presentation. So now let's start the session. And I'm the chair of this session, and together my co-chair is Dr. Alia from University of Indonesia. So please have the short greetings.
Hello, everyone. Okay. Good afternoon, everyone. Yes, it's nice that we have a meeting again after a long time. Yeah, but now we have a discussion again together. We will discuss about the development of e-learning, and I hope that will be a very fruitful session. And I'm happily co-moderating with Prof. Kuriko. Thank you, Prof.
Thank you, Dr. Alia. So let's start the session. So I will make the explanation about overview of this project. So please show my slide. So as you said, in this engineer workshop, it's the special session focusing our new project, development of evaluation criteria for e-learning training program for international telemedicine conferences in Asia. So as you know, in TEMDEC and the APAM Medical Working Group, we have long working for international telemedicine conferences, such as the International Case Conference or live demonstration. From the casual to the very official level, we have a variety of activities collaborating with international engineers. So, for example, the International Case Conference, the picture shows the neurology one, but we connect the Indonesia, many hospital and the Kyushu University, and show the case of patient and discuss. And the international live demonstration, the picture shows a live demonstration from AIG, and we have the live transmission from the endoscopy. And this picture is at the International Endoscopy Conference, ENDO 2022. So we work together and develop the system and the work for many events, international events, from the casual to the Congress, big Congress. Of course, we are the member of the APAM, and TEMDEC is a secretariat for the medical working group in APAM. So we have the very good technical collaboration between network engineer in the Asia and the Pacific, And of course, we have the training program in many APAN and also long training in TEMDEC. So we invite many hospitals in the world, and we came together and work for this kind of activities long time. But after COVID-19, there is a rising need for online training program. Of course, our activity is the development of the online collaboration for doctors. But this kind of setup or technical training should be provided in online as well. Because after COVID-19, we feel difficulty to invite the foreign engineer to hospital, or some hospital, some engineer ask us to provide the online training because the coming to the Kyushu take a lot of cost for travel. So now we get the grant for creating this, and this is the aim for the we are now trying to create some e-learning training program for the international telemedicine conferences. So the grant is the Japanese Society for Promotion of Science, Kakenhi, and we have the core member from the Japanese universities and the University of Indonesia, University of Brawijaya, AIG, and the University of Malaya, and many APAN members and engineers. And we have the 4 years period for research. And as we collaborate with professors in educational field, we developed a step for this training program. So first, we will develop the course objective. We decide the topic of the e-learning program, and the objective for the knowledge and skill required for technical staff for international telemedicine conference should be decided first. Then we will decide evaluation criteria. And then we develop a curriculum. And after that, e-learning training program will be open, and we evaluate by using this actual training contents. So this is a kind of scheme we will proceed. And this workshop, we just introduce our topics, knowledges, and also trying to sum the objective items in this workshop. So please give your opinion, free opinion, comments, knowledges, questions, and I would like to create the good one. So let me summarize the doctor-to-doctor telemedicine. So as this activity is within the field of telemedicine, and this is the activity between doctors. So this chart is from the information of the Ministry of International Affairs and Communication in Japan. And this is a model for the doctor-to-doctor telemedicine in case studies. And there is some purposes supporting for diagnostic imaging, including teleradiology and telepathology, or supporting medical care, including remote consultation in variety of fields, tele-emergency support, tele-ICU, telesurgery, and information sharing, and education and learning. So remote consultation or education or learning teleconference is one of our main objective within this D2D telemedicine. And to meet the training needs of hospitals in many countries in Asia, we set the concept of our e-learning training program like this. So one is focusing on using general and simple technology, like the internet and the teleconferencing, for setting up both domestic and international D2D telemedicine conference or consultation. And second is technology-based training that can be implemented regardless of the medical subspecialty or equipment installed. And third is practical technology that can be used as a reference in medical institution and also including recent technologies such as virtual reality. Because we need 4 years for develop the system and technology will advance. So we just include the new information in technology is really need. Then we based on this concept, we discussed and decided the contents of the e-learning training program. So first of all, the target is engineers and doctors who would like to set up and support doctor-to-doctor telemedicine conference and consultation. And the topic is this for 5 items. First, we need some overview lecture that explain the concept and introducing for the following topics and general information such as network, system, and security should be explained. Because all 4 other following items have same things, then we needed the explain in overview session. And the second is set up a big venue for hybrid medical conference. And the third is live medical demonstration, endoscopy live demonstration. So number 2 and number 3 is very big 2 types of the activity now. And the number 4 is a little bit the future technology, focusing future technology. So number 4 is 360-degree video on-demand transmission of the operation room. And the number 5 is the medical case conference using Metaverse application. So we try to make the variety, the contents, topics, accept the variety of the medical subspecialty, and the both use input the on-demand and real-time live transmission, and also using the Metaverse or 360-degree video. So again, the aim of this workshop is to share information about the objectives and the topics of e-learning program to be developed and discuss the required items related to the course objective in each topics. So course objectives, regarding the course objectives, the term need to be clear. It set out the necessary learning, which represents the minimum requirement for the training. And item of objective should use performance-based, can do. So cognition-based, can understand terms are not very much recommended. And items should be grouped together and numbered by group. So for example, we created overview, course objectives of overview part. So in overview part, training after receiving the lecture of overview part, trainees will be able to explain concept of D2D telemedicine, aim or case studies and or our focuses, and explain the technical formats of the D2D telemedicine, such as case conference, including meeting or webinar, live demo or on-demand or live streaming. And another is explain the appropriate internet for doctor-to-doctor telemedicine. So of course, the trainees needed to understand the stable network or small latency or international routing. And another is explain how to handle medical information based on consideration of technical ethical issues. So handling patient information, getting informed consent, following the rule on the association or hospital or each government. And explain the importance of the maintaining an updated system is also important. Updating OS on the device or apps is important. So yeah, I just have the brief presentation for many things, but I explain about the concept of our project and concept of our e-learning program, and also topics and the course objectives of the overview part. So thank you very much for hearing. And if you have any question in this moment, please give me. Yeah. Yes, please, Shishira Sensei. So can you use the microphone? So we have the remote participants.
Thank you. When would you like to have the feedback, or as we go, or do you allocate certain time for us to give you some feedback?
Feedback for the
Or whatever
items.
things that you are, so you were talking about the objectives and
Yeah.
you were seeking feedback from the audience, right?
Yes, yes,
Can we
yes.
talk about that now? Or
Yeah, of course.
Okay.
You can talk
So,
now.
yeah, I think this is a great project, an opportunity for creating something unique, very unique, because I'm in the area of education and training. So I'm very keen in seeing this type of things succeeding. So out of 4 years, how many years have gone, or how much time has already passed in the project?
Oh, sorry. This is the first year of this for project.
This is the
Yeah.
first year, so it just started. Yeah, that's important to know, because I think 4 years is a very, sort of substantial time for creating something very, very important. So, and also very systematically, sort of undergo some sort of a project. Therefore, I was thinking, when we were talking about objectives, why we are creating this e-learning course, what are the aims and objectives of this? So I think that's the key part in all the other developments. Before doing all that, probably we have to reflect on that very carefully. So I'm thinking in a very traditional academic way. Needs analysis is the first thing I would do to understand the objectives, why we are doing that. In order to do that, I would go about doing doing a needs analysis. Who are the recipients? What they think, what they want, what are the expectations? And out of that, probably you can have a very, very solid foundation. And 4 years of a project will give you a great opportunity to do that. You spend a couple of months, maybe 6 months, allocate for that needs analysis, select certain participants, and go about doing some interviews, surveys, focus groups, and ask. They probably already have some experience in they're doing D2D consultations. So how did you find it? What do we like to learn about it? What's more important? What's less important? That type of, very formal questions. And then you have a wealth of information to think about what objectives we want to achieve by doing this e-learning e-learning course. Sorry to take too much time, but
No, no,
yeah,
no.
that was my
Mm.
immediate thought. I thought, that would be a really good
Mm.
systematic way of approaching this.
Oh,
Thank
thank
you.
you. Thank you very much. Actually, I didn't explain, and our research, as a research project, we don't set the actual steps for the needs analysis steps, but our topic is based on the needs and the experience and our experience. And yeah, we have the long history for having the training program with many countries. And we take the questionnaire feedbacks. So, and we, in the engineering workshop, we provide this result of feedbacks, and we keep discussing. So maybe this kind of explanation should be, very similar, with the neural analysis part. And I realize that this kind of part is systematically embedded in the, this project. So thank you very much, but nice, really nice comment.
Yeah.
So please.
Yeah, Kuriko-san. Yeah, I have the two comments. The same one is like one is the survey, which is very easy nowadays. But since it is already done, I am not going to talk about that. The other one is the awareness. So generally, among the doctors, can we do something to create this awareness? This doctor-to-doctor telemedicine is also important now. That is one of my suggestion.
Doctor to doctor.
The awareness among the doctors. So like telemedicine, everybody is aware. Now, whatever we are going to create, so doctors should also know such facilities available for them.
I see.
As the individuals, like I have a data of so many, like thousands of doctors in India. So we can create something like Google Forms or something. It's very easy to reach out to them so that the people know that this technology we should use for the benefit of the patient.
Yeah.
That is one.
Yes.
My comment.
Yeah. Thank you very much. Yeah,
Thank
you're right. Yeah. Actually, our training was initially intended to have the targeted the engineer only, but now we have some doctors to join our project, and also Dr. Yoshinaga is like a working engineer. He will make presentation about the lab demonstration later. But yeah, of course, our training program should focus not only for engineer, but also
Doctors.
doctors, medical staffs. Yeah. Okay, so if not, can we? Thank you very much for hearing my presentation, and let's go to the next presenter. So next presenter is Mr. Tunggul Laksono from Brawijaya University, Indonesia. He will make presentation about another topic. The Faculty of Medicine, University of Brawijaya, telemedicine activity and OBS for live event.
Good afternoon, everyone. My name is Tunggul Laksono. I came from the Faculty of Medicine, Brawijaya University, Indonesia. In this day, I have an opportunity to give my presentation about telemedicine activity in my faculty and also the OBS for the live event in our activity. For the first time in early pandemic, Brawijaya University have Faculty of Medicine, Brawijaya University have only 20 accounts on 2022. And then after that, we purchased in 23 sorry, in 2020 we have 22 we have a increase of 40 Zoom during the COVID pandemic, and now the COVID already reduced. In 2013, we are decreasing until only 30 account, and planning for the next year, we reduce again until only 20 account in the next years. This is the activity in our university right now. Everyone has knowing Zoom has online meeting is become a daily life. So many lecturer can do their own meeting, and then they can manage their own meeting. Even some doctor in our faculty already purchased a Zoom by their own. But the reservation Zoom for the faculty still in the Zoom almost the same as the last years. So right now we have only handled for the specific meeting with the difficult equipment, difficult room, and difficult setup that we only handle. But the daily meeting is handled by their own. So there now we have a team that we create to only handle the special case, lab meeting, lab surgery, and other complex meetings. This is our Zoom reservation for all faculty members. If they need a Zoom link, they must reservation first, and then we will give them the Zoom links. This is the report of the Zoom, and this is the summary from the April 2020 until July 2021. We have almost 1,000 meetings a month during the pandemic of COVID. But right now, from the August 2021 until November 2023, we have almost the same from the last year. So it means that even the pandemic is stopped, but the habit to use the online meeting still intake until today. So the telemedicine now, the meeting is become a daily living, daily life of our lecturer in our faculty. So it means that everyone know the meeting by their own. They can make every day by their own. But today, we only handle the specific meeting that need to be assisted by us. Even some doctors, some have their own team for handle the complex meeting by their own. Right now, we are in our faculty focusing using the OBS to manage the display of the meeting, because the OBS is free, open source for screencasting, live streaming, and the OBS also provide a real-time capture video, support multi-camera for just like a video mixer. Then it's a very simple software to operate. Doesn't need a lot of big hardware to operate this software. And the most important thing that the output from the OBS can be accessed as like a virtual webcam, that we can combine this delivered to Zoom meeting as a webcam that can manage the display. We can mix the output to the Zoom, so we can make the Zoom become more interesting for the viewers. Other software, the option we are using the Femix, but the Femix is not the free one, so we using the OBS for the main purpose. This is the first that I will show you, the OBS for the Malang Annual Otorhinolaryngology Head and Neck Surgery course. We are recording the surgery procedure using 2 camera and 1 camera endoscopy. Actually, this setup we set up for the online, but the doctor said we are only using for the offline event in the one room. So actually, if we broadcasting this one to the other side, it's okay. But this is because the participant must pay the fee for the event, so they make it only for the offline, but we record it all for our documentation. So we are using OBS to layout, and then using the projector clip on for the doctor, so the doctor using the endoscopic wheel while explaining to all participants. This is some pictures. We have 6 table for surgery, and then all the participants have their own endoscopy camera, and the front there is an instructor that explain the procedure, and we are using the OBS to mixing the video to display all the activity of the instructor to the participant. The location is in the anatomic histology laboratorium. We are using the 6 decaptic cadaver head that mounting in the desk, and then using also 6 decaptic goat head that mounting in the head for the surgery. And one for the full body cadaver for the instructor, because the forensic doesn't want this cadaver decaptive, because later the neurology want to use this cadaver for the neurosurgery course. So we recorded all the session. This is some picture for during the event. We are using 3 camera. This is the setup. We have 2 camera, 1 camera in the front and 1 camera in the near for the focusing on the doctor hands. So because doctor want to show the participant how the angle of the hand when they're using the surgery, and then the right one is the camera output from the endoscopy camera. Actually, we can broadcasting this online, but the doctor want using offline. This is from other side. This is the OBS system, and we are focusing on the other participant. Yeah. Inside, beside that, there's all of the. This is a decaptic head, so sometimes we need some courage to do this activity, because we saw the head of the cadaver over there and full body cadaver in front of our eyes. Yeah, need a lot of gut to do this. This is the OBS system that we are running for the system. This is for the ortholenergy. And then usually we are using OBS also for the doctor outs. We are using, this is a setup for the large room. Usually, if we have 150 student graduates, we take the outs using, we are rent for the hotel hall, consists about 500 people. So we are using a lot of camera, a lot of cable over there. We are using 2 PDZ camera, 3 webcam, and we are also connected with the audio hotel usually. This event broadcast directly to the YouTube, because we cannot invite more people inside the room, so we must broadcast the one in the YouTube. This is the setup, just like this one. We are using the FR camera in front to show everything inside, and then the operators over there, we are in the back side. And this one is our activity in the back. But the common problems still occur in our activity, because we are using the very large room. Sometimes the USB cable extender makes some problem sending the video. If we are purchasing in the new one cable, it's okay. But if we are continuously using the same cable, probably 5th or 7th time, it will be some trouble become. So that's why we want in this next year, we already made arrangement for the next year. We had to buy the new PTZ NDI camera. So the camera will connect it not by USB cable, but using the network cable. So directly we can capture by network using the NDI protocol. Because in the last meeting, make some USB cables and make some trouble for us. And then next we are using Zoom webinar, but we don't have it. We are using Zoom meeting, but we are using OBS to simulate it how, just like the Zoom webinar, because we separate between the presenter and the participant. We are using two Zoom run directly in the same time, and then we using the OBS to manage the meeting during presenter and the participant. We connected within the OBS to deliver the presentation from the Zoom of the presenter to the participants. So we are using two account Zoom, one Zoom meeting and one Zoom Lots meeting. Because we don't have a Zoom webinar, we only have a Zoom Lots meeting with 1,000 participants. And then this is the interesting one. It's handled by the residents, not ours. So we only assistant them to how to handle, how to make them, and we provide the devices. Yeah. Yeah, we're running, this is one the task. We are using 4 laptop. So the 4 laptop that pin all the presenter and all the laptop that we already pinned the presenter, we input into the OBS and we manage and mixing with the OBS. And then the results from the OBS, we using as a webcam for the Zoom in the participant area. And the output distributing with the Zoom to Lots meeting with the security activities. And if some participant want to ask to the presenter, we are using another computer that connected to Zoom that showing the presenters. This is the picture during the event. This is all the residents, not engineers. This is the event for Subdermal, Surabaya, dan Pasar Malang. This is the meeting between the 3 cities in our province and Jawa Timur. This is a dermatologist, the resident of dermatologists that have their own meeting and then they handle by themselves. This is the situation that I captured by the video. This event will start in the morning until noon. So sometimes if you see there are some snack in the front on the desk. We provided the devices. They we set up the devices, but they manage it by their own. Yeah, we helping them set up the connection, the network, the interconnection between all devices, and we have provided all the laptop. They only set up the layout, the OBS by themselves, and then they arrange all the scenes with synchronized with the events. It's managed by themselves. The training they learn by themselves. Actually, they're using the OBS for the sometime for the daily meeting. They using that and yeah, 2 minutes the image of the video that they send to Zoom, and then when the time for the Lots meeting like this one, they already set up. And I don't know why in our faculty, all specialists, all residents, they have their own IT team inside the resident. And this one is apa ya, regenerasi toh? They teach this skill to their younger junior. So the IT residents is always have in every specialist. Usually it is one in the subdermal, and then in the cardiologist, no. The pediatric, they have their own IT staff. And the internist, the best IT staff, the best resident IT is from the internist. You know. Yes, like that. They have a club. they have much interesting in the IT stuff. Yes. And then this is the last thing that we do just in the last months. We are joining for different Zoom with the OBS. We have faculty have want to have some publication to all higher to high school student, the younger bachelor, and then want to have incoming student for the doctoral. So we want to have some publication using for Zoom with lots meeting, because we want invite so many people to join to introduce what is our faculty, what study program that we have, how to join into our faculty. We are making the publication online, so faculty won't have for Zoom with the 1,000 participant each Zoom. But in the opening speech, the dean must speak in the fourth Zoom parallelly. So we have to joining for Zoom using the OBS. So the concept is we have for Zoom, probably this is the schemes. At this one, in the below, we have for Zoom for the high school student, Zoom for new doctor, for this one, the material about the specialist, yeah, specialist, and then the postgraduate, and then for the, I forget the one. So we have for Zoom running parallelly. But for the first time, the dean want to speak to all Zoom. So we have a for presenter here for the general affair that we will present to all the Zoom over here. And then we combine it with the OBS, and the output from the OBS, we are using the HDMI splitter, and then we separate to all Zoom using all others laptop that join in every Zoom. After the opening speech, after the general information that already provided there, and then all the Zoom, the four Zoom running by themselves with the content of every Zoom material. This is some picture from that. At the front one, this is Mr. Angga. This is our engineer from the use specifically for the multimedia. This is in the front right is the OBS, and then in the back there is a 4 television. One television handle one Zoom, and one Zoom handled by 2 operator. So for the first one, we are using the OBS to deliver. In the other room is the presenter, the dean and the others. Presenter is outside this room. So like this one. We have 4 Zoom running parallelly, but for the first time, we combining all using the OBS. So the conclusion is, yeah, we are always learning by doing something. If we have boundaries, we will think how to solve it. That's one. What they didn't want, I want to for parallel meeting. You must think how to done it. So learning by doing, practice make us perfect. We must continue to learn how to new technology to improve our service, because in the future, more complex meeting will be appears in our hands. And this year, we thanks to Dr. Holly. This is my new chief here. He had provide us to one more IT staff in our office now. And then we have arranged also in the next years to have a new NDIP Pantil Zoom. Yeah, we can Zoom and everything in the for large meeting. And our university also just purchased new artificial intelligence server. It's very, very expensive thing. And the rector want all faculty to involve to input to develop this this artificial intelligence in all study program in our university. And all in this year also, our university launched the 1 gigabit connection between Brawijaya University and Tokyo for the ID RAN and the Japan RAN, already connected directly 100G using the fiber optic via Guam. So what next collaboration? Thank you so much.
Thank you very much for a very nice presentation, Tungu. And I'm congrats for the increased number of staff and very hard work in the center.
After 7 years, we just got a new member of staff.
Great, great. And any comments, question to the Tungu? Yes,
Yes,
please.
Saya Tengku. Very interesting presentation. I have 3 questions. Okay, probably the first question is how many Zoom account currently purchased by your center? And because I saw there are a lot of session you have, I mean, from 2021 until now.
Yes.
There's a lot, and it keep on increasing.
Yeah.
Okay, that is question number 1. And question number 2, I'm also quite amazed that you guys using OBS instead of a video mixer for very large conferencing or very large webinar. Are you guys using notebook or you guys using computer CPU? And what is the spec? If you can share with us. And my third question is for the webinar session, when it's handled by the resident, is whether the technical staff on standby or is totally on their own? So you after you set up and you pass totally on their own. Okay, I think that's all my question.
Okay, thank you. Our faculty have a Zoom account for the first time. Is a 20 account in early pandemic. For the first time, faculty medicine purchased the Zoom. But when the pandemic rise so high, so university want to purchase Zoom, but they want, you see, the faculty medicine Zoom upgraded the capacity. So our Zoom take out by university to improve the capacity. But in faculty medicine, for the early, we have 20 account. And then when the COVID rise up, we increase until 40 with one large meeting. So we have 40 account and 1 account for the large meeting, 1,000 meeting. But university purchase more. That's why from now, our Zoom for the first time purchased by Faculty of Medicine, but after that occupied by the university. My account still the owner for the Zoom. So I can see then watch all the Zoom meeting around my university right now. Yes, correct. Because still the owner for the Zoom account in our university. And then, yeah. And then for the last years, because the COVID is lower, and then all the class become offline again, the university reduced the amount of Zoom account, and our faculty also reduced from 20, 40, and then back to 30. And then for the next year, probably university has decided that the Zoom account will be suspended in the next year because university has signed with the Google for the Google Workspace. University want us to use more using the Google Meeting, but the Faculty of Medicine, we decided still use Zoom and for our daily activity, because right now with the Zoom, only in our faculty, we have a Zoom reservation using the Google form, and then we see the amount of the meeting in a month is almost 1,000. Wait, let me show you again. It's still high usage in this these years. wait. In this year total is always around 7,000 meeting a year. So it means around 500 meeting in a month. It's handled by only 30 Zoom account. Even 30, not we are using all, because all every study program in bachelor, we give them for one account each for the daily routine lecture. So we are not using all 30 for handle this 500, only around 20 or 15 account to handle. Then this managed by the Kuswin. The Zoom reservation, making the link is by Kuswin and delivered by the Secretariat of RT from the Mamina to deliver to the who reserved the meeting. And then we are using the OBS. Right now we have two kind of OBS that we're using. The one using laptop, the ROG laptop from the Asus for the gaming laptop. It's a Core i7 Gen 10, if I'm not mistaken, Gen 10 with a 6 gigabit RAM and 2 terabyte NVMe. And the other one using a desktop PC using Core i5 Gen 10 also, if I'm not mistaken, using the 16 gigabit RAM. And for the technical stuff during the OBS, actually, for the first time, they came to us and consult. They want to have the meeting. They give us the specific devices that they want. I need one OBS. I need 6 laptop, 10 TV, probably 2 or 3 television for monitoring. So the TV is they using the TV monitor using is the display that we'll see by the participant in the Zoom. So they display there for monitoring the OBS is managed by themselves. And actually for that day, when the event occur, we are the technician only assist inside the outside the room. Usually they want us to manage the network, and they only manage the content of the meeting. But the technical thing still on us. But how to control the OBS, how to deliver, it's set up by us. Like that. Thank you.
Thank you very much. Nice question. So it's running time. So thank you very much.
Thank you so
And
much.
discuss later. So next presenter is Mr. Zahir from University of Malaya. So he will make the presentation about technical support in University of Malaya.
Hello, hi. Very good afternoon to everyone. First of all, I would like to thanks TEMDEC and Corico for inviting me to this conference to present about a topic today, which is about a little bit on the technical and supposed to be suitable for engineering workshop. Right. Okay. You can see my slide, right? Okay, a little bit introduction about myself. Okay, I'm about 22 years old. No, 22 years with University of Malaya Medical Center. So I've been actively involved in telemedicine since 2010. Okay, probably I have to shave everything. so, so this the picture. I think 5 years back. Okay, so I have with telemedicine activities in Malaysia and also for my university. okay, for set up telemedicine design and transmission last time, and also train new engineer also for the university and also for Malaysia. I was promoted to become IT manager from 2014 until now. And currently I hold the position as Deputy President for Malaysian Telemedicine Special Interest Group from 2012 until now. And also I, together with Medical Working Group. So this is a t-shirt I'm wearing today. So we have a special t-shirt. So I still can wear. So this t-shirt is very high and good quality. Okay, a little bit introduction of my hospital. This is University of Malaya Medical Center. It's actually a teaching hospital for the Faculty of Medicine, University of Malaya Medical Center. Okay, the hospital is established in 5th August 1968 to cater three main objectives, which is the healthcare services, healthcare education, and also research. And this is the first teaching hospital in Malaysia. So that's mean our hospital is become the role model for other teaching hospital in Malaysia. So basically whatever that we had done at University of Malaya Medical Center will be followed by other teaching hospital in Malaysia. So currently we have around 2,000 doctors and 6,000 support staff. The hospital capacity is about 1,600 beds. Okay, and we have around 5,000 outpatient. And also we have around 300 inpatient admission daily. So about UMC Telemedicine project, we have actually currently we have two project, which is a telemedicine and this is more on the doctors to doctors program, and the other one is about teleconsultation, which is a doctor to patient. So I will try to cover both basically in terms of technical support. Okay, for the objective of our UMC Telemedicine project basically to provide healthcare and patient access to remote location. So actually we are quite in center actually Kuala Lumpur, so we don't have a rural area, but some patient are actually outside of Klang Valley. So they are about 200 kilometer away, or more than that, which is also been referred to our hospital because our hospital is a tertiary hospital. And also to facilitate medical practitioners, clinicians to make a follow-up assessment to the patient health, especially through audio and video, increasing patient participation in health assessment, and also to have effective learning to doctors using remote distance learning and knowledge sharing among doctors. Okay, for doctors to patient, we have an online teleconsultation training using Schoology. Schoology is an online training platform in Malaysia. It's quite popular in Malaysia, where we put all the content, basically how to conduct telemedicine, or how to do the teleconsultation. We have many modules. One of the module basically how to use the teleconsultation system and how to support the teleconsultation system also by the nurses. So nurses actually playing their role basically for doing the support. So this is some photo taken during the training. We have online training, training, and also we have a hands-on training. This is something like hands-on training, where the explanation will be done by the nurses team to the few junior doctors or medical officer. And this is also another training also. Sorry. Okay, we're done at the clinic. So this is a clinic inside the clinic. So they have a on-job training, and this is in a classroom where the nurses, this is the nurses that trained by IT technical, basically how to handle equipment for telemedicine, or how to start the telemedicine, or how to train the patient later on. So the training we cater to for nurses and also for doctor how to use the telemedicine or teleconsultation, and the nurses basically how to do the support. Basically, nurses will play the part basically to train the patient later on how to use the apps, how to use the patient portal. Okay, this is teleconsultation with patient. This is the recruitment process. So patient need to fill up a consent form
So because in Malaysia under telemedicine app, patient need to give consent before they can start with teleconsultation or telemedicine. Okay, and the nurses will guide, and this is the doctor basically will accept the consent. So and nurses will train the patient how to use the the patient portal and to how to launch the application for teleconsultation. And this is some simple test lah, basically how to make sure they can establish the connection. Okay, in terms of infrastructure at the doctor's room, okay, we just only need a computer with additional screen basically to open the patient record. This is on the second screen, and this is the main screen basically to show the patient video. And we have around 25% of the clinics of the computer in the clinic to have this kind of facility. So for example, if there are about 10 rooms, so 3 rooms will be available with these facilities. For internet connection, we just need about 4 megabit per second, and it should be behind the firewall to keep the connection secure and privacy. Okay, and most importantly, the doctor will be able to access the EMR. So the procedure is the patient need to be doctor need to be there 10 minutes before the appointment slot. So because we break into many slot for the patient for the consultation, and the consultation the maximum time that we allow basically is 30 minutes. Okay, because we want to make sure that all the slot will be we will not run out of time. So that's why we recommend doctor to provide the maximum consultation for 30 minutes only. And for the patient, they need to log in. For example, the appointment time is 9 a.m. So they have to be there 8:30 a.m. Because for the nurses to do some connection tests and also to make sure that they're ready before doctor come. Okay, and nurses, since we train them to do basic troubleshooting for connection test with the patient, which include how to test on the internet. So they also, if there is a problem, they will call the patient using WhatsApp call and ask the patient to basically to fix the internet connection, or sometimes with regard to the camera or sound or audio. But since we are using Zoom at the back, so I think it's quite easy for the patient to handle, and mostly sound quality is very good. Okay, and if there is a problem, so nurses will call for IT support, which is from my team via WhatsApp group. So they will trigger the problem, then my team will go and help with the connection. Sorry, usually with the internet connection only. Okay, and then if everything is ready, so doctor will start the consultation. And let's say if there is a problem during consultation, and if cannot be resolved within 5 minutes by my team or by the nurses, so doctor, as a contingency, doctor will make a video call to the patient directly to finish up the consultation. Okay, and my team, basically we will on standby, on site at the clinic within the first 3 months, and after 4 months onward, we'll be on call basis. So we will stand by at our office. When there is a problem, we try to remote in, or else we have to go to the site. So this is the support mechanism that we have. And by having mobile apps, okay, this is the app that we launched in Q2 this year. So basically, it will simplify most of the process, because using app, we can have a notification, because the apps will notify the patient for the teleconsultation session. And also there is a support in the apps also that they can provide the problem, or they can issue something like complaint. So in order for us to take the action. Okay, and the future plan, we plan to have what we call as telemedicine hub. we call as a virtual hospital. So next year, well, probably this one will have a dedicated room with about 20 where can be used by 20 doctors concurrently to do the remote consultation. So we will have one IT people to stand by at this location in case of technical issues. Okay, for the doctors to doctors telemedicine, I think almost similar with Mr. Tunku presentation, but in a smaller scale because we don't have not many as compared to whatever Tunku presented. Okay, usually for doctors to doctors telemedicine, we have for meeting or discussion, we have a webinar. We also use for training and also we use for large conference. Okay, this is my telemedicine support team for doctors to doctors program. Okay, I'm the project manager for this. And we have two, Helmi and Hafiz, which is backing up each other. And they're quite specialized in Zoom control with AV and sound mixer and also the projection system. And under them, there is a AV support team. There are two engineers actually, Nazarul and Hassan. They will have on the microphone, camera, and also Zoom support as well. And we had also the network team. There are 2% also. Will support in terms of a network connection. So if you can see, they are pair. They're working in pairs, and most of the time, they are working only 1% at one particular job. So maybe for large conference, then only all of them will be working together. Okay, for doctors to doctors telemedicine support, especially for meeting and discussion, basically this one totally handled by the user themselves. So we provide a basic training for the coordinator. Each department they have around 2 IT coordinator. So we train them how to operate Zoom, how to operate with the camera and video mixer. Okay, so we provide this basic equipment for each department. Okay, and for the Zoom account, since we only have 20 Zoom accounts, so we cannot give them a dedicated account. So they have to request, but in quite traditional way. I mean, they have to request through email, not like the one that Tungo shared now using form, everything very nice. But we keep track them in what I call our online form. Okay, and then for those who need telemedicine, since our network is integrated with RAN network, so at the gateway level, we implement border gateway protocol, where if it detect that it's going to RAN connection, so it will pass to my RAN. Okay, right, and they will only contact us if there is a technical problem, and mostly a network problem. But my engineer, for network engineer, they will monitor at the office to see on the network utilization whenever they have. Okay, and for the webinar support, this is a session support by my engineer. We have Hafiz here doing the control for the OBS and also the Zoom mic. Okay, and also we have studio. This is just completed in August this year. So basically, this is more like a permanent setup where it can be used anytime whenever there is a request for webinar or conference. Okay, and the setup over here is already fixed. So we just need to turn on whenever they want to use. Okay, and for live support work. So for the workshop, so we need a bigger team basically to support this workshop. Because for example, this is from last year for GIA courses. So we need extra support from university team. Later I will explain. Because this live surgery is coming from 4 OT, and each OT they have around 3 input, including the OT camera and also the scope input. And also there is international or remote participant will join or join this workshop. So it's quite a complicated setup in the auditorium. So extra support is coming from a university team led by Amin and Mr. Hanafi. I think probably some of you might know Mr. Hanafi. So they have around 4 cameramen, which is coming from the student who are doing the internship. Okay, and the rest thing that also will support by my team. Okay, this is some of the photo taken from the live workshop. So each of the OT they have around 3 camera input, and there is a lot equipment need to be linked up, including the fluoroscopy and also the from scope view. Okay, this is one of the live workshop. Okay, this is doctor who are doing the control for the slide. Okay, and this is 2 from multimedia team in from the university, and this is my team from the hospital. Okay, and the summary of the activity that we have for 2023 for doctors to patient, we have around 1,181, and all of this session is supported by the nurses and the doctors, and for doctor to doctor for meeting and discussion 154 for the entire 2023. So this is also done by the doctors in themselves and with their medical officer. And the webinar is currently handled by my team, so about 23 for this year. And for big conference, there are about 5 so far for 2023. So in conclusion, I think the most importantly is the training. You need to train people at all levels, including the patient. Okay, and training is a key success factor. And the more you do, basically, you can detect the problem and you can improve from time to time. And whenever you do, I mean, you have to get involved all at all level. I mean, especially the management level, to provide support, to provide financial support and budget, basically to have more people and also have more equipment. And I would like to thank COVID-19 in a positive way, because before COVID, I think people are quite reluctant, especially on the teleconsultation. Doctor try to, they they want to see the patient in front of them in order for them to consult. But during COVID, I think it teach us a lot that teleconsultation is one way more efficient. In fact, I mean, people can save a lot, especially traveling time. Okay, that's all. I will end my presentation.
Thank you very much for a nice presentation, Zakir. So I really impressed that your activity very much, activity in D2P and D2D.
Thank you.
And any comments, question to him? Yes, please.
Thank you for your presentation. Actually, I'm a little bit confused because maybe I don't have any imagination about this telemedicine. I'm just confused. Where is so the patient is at their home,
Yes.
and the doctor with with the nurse,
Doctor with the nurse.
with the nurse.
Yes.
So in the previous picture, you said there is a patient give informed consent and other. So in my, I think the patient with with the nurse and the doctor in other place. No.
Oh, no.
Because in your picture, there is a patient give informed consent
Yes.
with the nurse,
Okay.
and after that, the doctor in other place.
Oh, okay. The situation like this, probably you can share my slide again. I show the photo. Okay, it's like this. For teleconsultation under Telemedicine Act in Malaysia, the patient need to be recruited first by the doctor, not for the first time. I mean, probably for the follow-up appointment. So this is right after the the follow-up with the doctors. Okay, and doctor is asking the patient whether are you okay with teleconsultation. After the patient agrees, then they go to this, fill in the form. So once patient are okay, they will sign the consent form. Then nurses will train how to use the telemedicine platform. Yeah.
So usually, you use this telemedicine. It's for
Follow-up.
for the old patient.
Yes, yeah,
and then
existing
usually
patient.
regular
Yes, regular follow-up.
follow up.
Yes.
Go to the hospital like a hypertension patient. or
Yes,
maybe
usually
after surgery
hypertension patient, diabetic patient, and some also we have I think surgery patient also.
Mm.
Yeah.
So maybe because you are IT, so maybe you don't know the procedure. But if from the telemedicine,
Mm.
is the insurance cover the cost?
Yeah. Currently our insurance cover for teleconsultation. Because we had extend some of the scope under the insurance cover. Last time we didn't immediately implement this because there are a lot of things that we need to consider, especially on the legal aspect and also the insurance coverage. Yeah.
Okay, thank you.
You're welcome.
Thank you for
Okay.
the next question. Yes, please. Yeah, you have many D2P activities, so yeah.
Yeah.
Can you hear me okay?
Yeah, I'm okay.
Yes, I think fantastic presentation, fantastic example. You completely destroyed me. You were thinking that we are the only ones doing teleconsultation.
Oh my.
Yeah.
Actually, there's a lot, no?
Now, you talked about doctors providing consultations,
Yes.
treatment to the patients on a regular basis in the clinical environment in the hospitals, right?
Yes.
So that's one example you gave us. That's great. I was more intrigued about another aspect. You were talking about teaching medical students how to do consultations,
Yeah.
teleconsultations. Is
Yeah.
that right? Were
Uh,
you talking about that? You know, you are teaching medical students
Yes.
to conduct teleconsultations. What
Yes,
is your-
it's indirectly because for example, let me share. Okay, for example, this is actually one of the station where this sorry, I think this photo. Okay, this doctor have telemedicine.
No, I think
Mm.
before that before this you were talking yeah, somewhere there, teleconsultation training, I think.
Yeah. Yeah, I think this one.
Okay.
Yeah. So indirectly, doctor also will explain how the medical officer to do the teleconsultation and telemedicine with the patient. Yeah.
Okay. So you are not teaching medical students in a formal way within the curriculum as
Yes.
a part of their teaching, right?
Yeah, you know.
Okay.
Yeah.
We are already doing that, so therefore
Wow.
I win here.
Yeah, okay. Congratulations. Then you're it. Yeah.
He
Thank
will
you.
make presentation about his activity
Right,
tomorrow.
But actually, I cannot wait to hear from Dr. Yoshinaga, where they are doing
Yeah.
live translation themselves.
Yeah, yes.
Right, okay.
Okay, so it's running on time, so let's discuss later. So Takeo, thank you
Okay.
very much for a nice presentation.
Right.
So these two presentations were regarding the general technical support in the institution. And after that, we will have the two presenters from the live demonstration regarding live demonstration. One is very high volume, many big center, Asian Institute of Gastroenterology, and Chief Engineer Satya will make about live demonstration. Yes, please. Yeah. No? Okay. Doctor to doctor, telemedicine education. Okay, thank you very much.
Basically, I'm from the private, it's a private institute. So, government institute. And I am from a private institute where we have very good support. Director of Government,
Sorry. Yeah, he's Professor Dr. Reddy, and he's well known all over the world. He's one of the best gastroenterologists, and he is very keen in promoting like telemedicine or the academics. So academics part is very important always to spread this telemedicine concept or the medicine to reach to the needy people. So as soon as we talk about telemedicine, it's always based on the rural population, whether it is telemedicine to the patient or doctor to doctor telemedicine, because the technology is not available, the medical advances are not reaching to the rural areas. That is why it is always important to focus on the underdeveloped areas like remote areas, villages, and these places. So in Asia, generally, the most of the population are in the villages only. So before I go into the my lecture, I wanted to talk about this. I wanted to make my presentation into 4 parts. What are the benefits of this doctor-to-doctor telemedicine and the challenges what we are facing now, and how the future is going to be for the doctor-to-doctor telemedicine, and the activities what we are doing at our institute. So these are the 4 points I'm going to cover. So first we see the benefits. You can see the skill development. Skill development is in doctor also needs the skills. So maybe somebody in rural, we don't get all the specialist doctors like related to cardiology or pulmonology or the orthopedics. We have a general physician who needs to be updated his skills in all the areas. At least the basic knowledge he should gain. So then only he can treat the patients there, whoever is coming to him. So he need to develop his skills in cardiology, orthopedics, in any division. At least he may not be able to treat completely, but initially he need to attend, and then he should be knowing where to refer this patient in further. So that skill development is very important for the doctors. So that can be achieved by this doctor-to-doctor telemedicine. So he need not travel all the way to learn these subjects, and he need not spend a lot of money on this. So it's very simple. Now the telemedicine concept has come. So this made their life very simple to develop their skills. The other one is the growing importance. Future, it is going to be the telemedicine only. So if down the line, if you see 15 years, 20 years down the line, the concepts are changing and people are more into telemedicine. As Mr. Zahir said, thanks to COVID, before COVID, doctors would like to see patient physically. They wanted to see the patient in the clinics. Now, after that, there are a lot of changes happened and everybody is very prone to accept this telemedicine and to reach out the patients. So because of this growing importance of telemedicine, in the doctors are also forced to learn these technologies. So they have to acquire these techniques, otherwise they'll be behind. The newer generation, like you saw in different presentations, Tungul and this thing, the residents are handling the live workshops. So that means they are forced to, like we have the doctor here. So they need to learn that these techniques. That is why that is where they can just grow in their profession in future. And the growing technology. At the same time, the importance is growing and the technology is also moving very fast. So every year we see new technology in reaching out to the doctors or patients. So since this technology is growing and the importance is growing and the access, earlier the internet connectivity is to be very poor. Like in my country, in rural areas, we never used to. We used to conduct rural health camps. We used to go with a satellite dish on the vehicle, and it will take 2 hours to set up to connect the satellite and to get connectivity to the main hospital. Whatever procedures we do in the villages. So that used to be a Hercules task. Now in the mobile, I get the 4G connectivity and just connect it. It's just 2 minutes job now. So the access has been increased. So all these points are very important for this doctor-to-doctor element. And the other one is cost effectiveness. So once whoever is patient is coming to me, if I can provide him the care in different areas, so I am saving his cost. He need not go to the other cardiologist one place and the other doctor one more place and the other city. So the cost effectiveness is there. So that is why doctors telemedicine is very important for there to upgrade their knowledges. And the challenges, they are mainly the limited infrastructure and the regulatory hurdles. The limited infrastructure in the villages, still the many hospitals are small hospitals. They are not very keen in establishing these telemedicine centers because of the technology, because of the equipment and the costing and other things. So maybe some corporates, some agencies should come forward to establish these telemedicine centers in the villages to reach out. The infrastructure is very important. Maybe doctor is very keen, but he may not be getting that infrastructure which is needed. And the regulatory hurdles. Regulatory hurdles are for telemedicine, like it is not there in the curriculum. Now we started talking about the including this in the curriculum. So that government recognizes this and they make it as one of the subject when they are just doing the medicine and the licensing also. Licensing is not there for treating patients on the telemedicine. And the other one is the reimbursements. Like some insurance companies in my country, the government reimburses. Like if he's a government employee, government reimburses. So for the telemedicine, there is no reimbursement either by insurance or the government. So there is no encouragement for that. So that's why people prefer to go in physical and see the doctor. The other one is safety of the data. That is also very important. So these regulatory hurdles can overcome, then it is going to be the wonderful technology. And what is the future now? So naturally, we are talking about this. The future is going to be the imaging in telemedicine. And there are few things what are happening now, like Tungul already said, they have acquired one server with artificial intelligence. Artificial intelligence is entering. Yes, I was interacting with Sirisa from Australia. So this is going to be play a major role in the treatment part, in telemedicine or in the treatment. The big data is going to come in picture, and this is going to play the vital role. The artificial intelligence, in the same way, this integration with the wearable devices. Like I have the Apple Watch and I have the trackers and everything. So my wearables are connected to a server and the doctors can just have my data instantly. That data is transferred to him and he can monitor and he can inform me, you are going to have this is problem. So that is why, and the virtual reality and the augmented reality, because I'm not talking in detail of these topics. So these are the 3 points that are going to play very major role in future of the telemedicine. So because of this, doctors are forced to learn telemedicine and they should update their knowledge. And the last one is our activities at our institute, what we have been doing and how we are doing these things. So this is the first one. Like everybody said, the COVID initiated these activities to educate the doctors. When COVID started, everybody was blank. No one knows what is going to happen, what is going to be the treatment, whether people should get worried about it or it's okay, what medicine they should take. There is no publications, no protocols in the initial stage. That was the time we started a series called this COVID-19 guide. Ours was the first institute in India to initiate this process and educated all the doctors. Every week we used to have one program on one subject, on cardiology and what is the impact of COVID-19. In general medicine, in gastroenterology, in neurology, we covered all the subjects and finally we released a book on the guidelines. These are the COVID guidelines. So this was, even now these programs are there on our YouTube channel and our Facebook also. So thousands of doctors attended and it was much appreciated. So this activity really gave a boost to us also. Okay, people are now interested in joining virtually to learn these topics. The other one is now what we're doing IBDNC. This is an emerging nations consortium where is inflammatory bowel disease. This is our website page, and we have participation from 24 countries, and we have 900, around 1,000 doctors are already there included in this. So this is the platform what we created. This is for the doctor. This is not for the patients. All these are doctors. And this is the platform where they exchange their issues, their topics. Like what is happening in India, what is development is happening, what is happening in Sri Lanka, suppose. Like it differs. The pattern of this IBD differs in each country. It is not the same in every place. So this is the common platform where we created. They share they share their publications, recent publications. They share their case presentations and the solutions. We have a team in this where they provide their inputs. They exchange their knowledge. This is the best platform I can say for whoever is into the IBD. This is the best place for them to learn IBD. This is only for the doctors, and the patients. We have a different portal for them. The patient is only the Facebook page where they post their complaints, their issues, what to eat, what not to eat, and other things. That's a different area again. These are the main activities too we are doing. The other one is the clinician scientist. We have a basic science lab at our institute that is in different building, and the main hospital is located in one building. So what they are doing, we don't know, and what the doctors require, even they don't know, because everybody, scientists are busy, and the doctors are clinicians are busy. So we combine these two big groups, and we invite scientists from outside, from other countries, from our other cities in India, and the doctors from all over the world. So they can join on this day. Every Wednesday or Thursday we have this. Every Thursday we have this program. People can join and discuss what the new thing is happening in medicine. Like, and based on that, our researchers, they work on those lines, because otherwise there are two different lines. They never meet each other. So they should know what they require, and the scientists should know what and they should work. So this is the best platform for the clinicians and scientists. And this is very recent program what we developed. This is the fellowship program for the physicians. So like earlier I said, the physicians are generally in the towns or villages. So we have this program called the fellowship program. We just educate them on every month on one topic. This is 1 hour program. This is the basic knowledge we provide. So suppose some cardiac patient is there, when to refer him to the higher center rather than treating there. Which point they should refer this patient, till which point they can treat this patient. What are the basic treatments they can provide there? In the same way, we have the neurology, we have cardiology department, hepatology is related there, sleep apnea related are there. So this is one of the best program which is going on now. And we have almost 800 physicians joined in this group. After completion of this group, this course, we'll just provide them with the fellowship certificate from our institute, and it is endorsed by one of the government organization also. And apart from this, these are every month we do almost 3-4 live workshops to different places, different countries. I don't want to talk much about these programs. So these are regular programs like surgical workshops and endoscopy workshop. These are all surgery workshops, what we did. And these are the endoscopy workshop, what we transmitted to different countries. And these are also like endosono workshops and endoscopy workshop. And this is what Ms. Kurikasan was discussing. That's the Endo 2020. That was that very tough task for TEMDEC to coordinate with different countries doing the live transmission to one place. And very like each center has got 8 minutes, 12 minutes time. And that was very well organized, that event was. Still we talk about that. So my conclusion is this doctor-to-doctor telemedicine is always going to be beneficial, and it's technically advancing, and people should come forward to learn this technology as well as to participate in doctor-to-doctor telemedicine. programs. Thank you very much.
Thank you, Satya. Can you hear that? Yeah. Thank you, Satya, for your nice presentation. I'm always impressed that your tones of activities, and also I'm very much interested in the you have many D2D educational activity, but you get the charge. You ask charge for
No, we
No.
don't charge anything.
So in case that, do you think do you think it's merit, or what is the merit for the your activity for user? Of course, user have the education experience, but for AIG, what's the merit?
Yeah, that initially I said I showed my chairman. He's an academician. He's always into teaching. So his keen object is to spread this medical education to the youngsters, because now the generations are changing. Earlier generations to be very dedicated in learning. Now it is not like that. That's why it's only to it's our part to the society to spread this education. We don't charge for any of our programs. Even for our physical conferences, that is what doctors say. Then outside we pay like $300-400 minimum for the for attending conference. We invite all the doctors the free of cost. We don't charge for any of these academic programs.
Okay. So do you have any grant for your
No,
project?
nothing.
Right.
It is all supported by the institute only. In fact, we have a department academics to run this live workshops or CMEs, all the educational programs for training the doctors. We have a separate department established for this, only for this purpose.
So you get a good team, good agreement or understanding from the hospital and the doctors.
Yes,
Okay, thank you very
it's
much.
goodwill to the hospital.
Wonderful. So any question, comments to Satya? No? Okay, please.
Yeah. Sorry, I keep this microphone to myself. It's
You
accident.
can keep
No.
your microphone
Take it home,
if you want.
Sorry about that. No, Satya, great stuff. Very, very impressive work that you're doing. But this comment is not particularly about your work. It reminded me something that might be interesting to Kurikos, this project. So this project is focusing on D2D education and training. So I have heard a lot of different examples of live transmission of education, but there is a very successful, very impressive worldwide non-real-time educational programs as well, which is called what do you call it? Store and forward telemedicine programs. I think in educational component or the package that you are offering or are developing, I think non-real-time or store and forward should be a part of it as well. Because, for example, Swinfund Charitable Trust, so they practiced this store and forward system, which started 20 years ago as an email-based consultation. But now it has spread all over the world. Doctors are using this particular hub technology, and it's so instantaneous. So the query comes from, say, for example, Africa, very poor country, to the hub, and a specialist in Japan immediately respond to that. So that system really goes well and very successful. I think it may be considered as a way of another way of interacting, supporting doctor to doctor. Thank you.
Thank you very much for such a nice comment. So thank you very much, Satya, for the presentation. So I will hand this microphone to my co.
Cheers. Thank you. Thank you, Kuriko. So next, we already heard some explanation, some experience about telemedicine activity, telemedicine training from the engineer's perspective. And now we have opportunity to listen from the medical doctor perspective, Dr. Shigetaka Yoshinaga from National Cancer Center Hospital, Japan. And the title is very interesting. We can manage internet live demonstration only by ourselves. So, so we are looking forward to have your interesting presentation, bro. Thank you. Please.
Thank you for your kind introduction. I'm Shigetaka Yoshinaga. I'm not an engineer. I'm a medical doctor. So my presentation is we can manage internet live demonstration only by ourselves. So one day, my boss, Dr. Yutaka Saito, told me that Italian society was interested in having a live internet demonstration from National Cancer Center Hospital. And they also wanted us to perform one live case each on 2 days. However, in National Cancer Center Hospital, there is no engineer who can do internet live with us like Zahi or Satya. So therefore, it was not easy to do live demonstration for us. My boss said at Kyoto Prefectural University of Medicine can live demonstration were easy done without any preparation. So however, I found out that the medical informatics department of Kyoto Prefectural University of Medicine properly assists doctors. So my boss asked the medical informatics department of our hospital, but due to the lack of manpower and lack of such experience, they told us to ask an outsourcing company to help us. Finally, I still had to do myself. First, I assembled a team of computer savvy staff. Mr. Kurashige is an endoscopy technician with 33 years of computer experience, and he can remove and install hard drives or other component himself. And Dr. Takamaru is a medical doctor with 36 years of computer experience, and he can assemble computer himself. And I'm a medical doctor with 40 years old, 40 years of computer experience. And I used to program in BASIC when I was in elementary school. As is the situation under COVID-19 provide an opportunity for Zoom to develop and spread. And Zoom has made it easier to connect with people far away. So we decided to use Zoom for this live demonstration. So the engineer of Italian Society told us to prepare 2 video signals, the endoscopy and room image, and 2 audio signals, the operator and commentator. This is a system plan for this live demonstration. We need to send 2 images and 2 sounds at this time, and we don't have enough equipment such as mixer. So we decided to use 2 computers as shown in this figure. And we would share the endoscopy image using the second camera of Zoom. For this reason, we plan to use 3 computers, a Windows desktop with a good CPU and GPU, a Windows laptop with a so-so CPU and GPU, and regular MacBook Air. The Windows desktop would be used to send the endoscopy image connecting to the wired LAN. Windows laptop would be used to send the room image with connect to the wireless LAN, and the MacBook Air would be used to check the status. This video is a test we did in September within our team. あれ、ごめんなさい。
今2つ画面が映ってて、
うん。
右と左、これ何が違うんですかね？
Japanese
同じ
coin.
です。多分
同じ。なんか
もう一見
時間差で映ってる。
一系統しか出てきてないだけです。
At this time, I forgot to optimize for video, but image seems to be sent without any problem. The day before live demonstration, we tried to connect with Italy to test. However, the main desktop, which was connected with wired LAN, could not connect to the internet for some reason. We all tried to set it up, but we could not connect to the internet. So we sent the endoscope image on Windows laptop and the room image on a MacBook Air, and the test was finished. The next day, unfortunately, Mr. Kurashige managed to connect the desktop to the internet again. So we could use the 3 computers as per our initial plan. So we are able to start the internet live demonstration successfully. At the first day, Dr. Saito performed endoscopic treatment of the rectal lesion. I show you the video of magnified endoscopy.
Yeah, this is the type 1 pit normal. And the lesion, not only the center part, but the most of this lesion showing the type 5I low irregular. So this kind of the detailed pit pattern observation is really helpful.
Next, I will show you a video of the ultra high magnified endoscopy.
The time.
Yes, of course, because there is some learning curve, but I think it's a little bit easier than
nice, very nice.
conventional colonoscope because this is a contact method. So we could contact on the tumor, and then this is maybe EC classification might be EC type 3A. So intermucosal to SM slight carcinoma. No.
Finally, I will show you a video of the treatment.
And now we could inject glycerol through this ORISE Pro knife when we need. So it's very nice, useful. It is not necessary to change the device many times. And now that we are including the small angiocarmine in glycerol, so we could see some mucosal layer like this. So during you are dissecting the blue layer, there is no risk of perforation.
So we are able to share a beautiful image as shown. The second day, Dr. Abe performed endoscopic treatment of gastric lesion. Here is a video during observation.
So the same. So we normally start gastric cancer screening from 50 years old. Age 50.
And the surveillance is for all population or starting by the high risk population? Which for you, the high risk in Japan, because it's very different from here in Europe and Italy, especially.
Oh, that's great question. That's true. So the risk of gastric cancer occurrence is quite different among the population, according to the risk of the gastric cancer.
So we thought there was no problem. However, the engineer of Italian Society said the endoscopy image is a little bit laggy today. So they asked us to confirm we had optimized for video. So we confirmed it at one point, and of course we had optimized for video. However, right after the confirmation, the image from the second camera couldn't be shared.
Yes,
Of the endoscopic stream.
yes. Now we are going to restart.
I mean, we are almost ready.
So, and we could not recover. So having no choice for us, so we decided to distribute the endoscopy image like a webcam and continue the internet live demonstration.
Yeah, so if we look at the vascular pattern in this area, now you see the irregular microvascular pattern. Irregular means irregularity in shape, distribution, and arrangement. So surface pattern looks like the irregular, but if you look at this area, so you see, yeah, network mesh-like vascular pattern with some irregularity. So based on this endoscopic feature, I suspect.
So here is a comparison of the first and second day's image. It looks almost fine. The image looked fine when enlarged, but the resolution of text was clearly different. The Italian professor sent us an email saying the quality of image was excellent. So I thought that we had succeeded. So my boss planned to perform the live demonstration again, and he believes I will help him and manage technical issues. The next step is to send a beautiful picture-in-picture image. We're planning to purchase equipment for this purpose. In conclusion, we could manage internet live demonstration without any engineers. However, once trouble would occur, it might be difficult to recover completely. So to tell the truth, we want an engineer to help us. Thank you for your kind attention.
Okay. Check. Is it in? Okay. Thank you, Dr. Yoshinaga. So do we have questions from the audience? Or, okay, yes.
Very, thank you very much for nice presentation and your hard work.
Thank you.
So I understand there's a very nice quality, but since you get the question from the Italian side for the image quality, so I am wondering if your recorded video is recorded in National Cancer Center or in Italy?
In National Cancer Center Hospital. Because I don't know why, but they did not record the image, video.
I see. Okay. So maybe we needed to take care for, our lesson from your presentation is that we needed to check the both image online and on-site online venue. And I also impressed that the sound quality is really nice. So do you have any special microphone?
Yeah, so we bought 2 new headsets. So bone conduction type. So they're very nice. It's very nice. But the one with the problem, so the other staff could not hear any sound from the Italian venue, so that they couldn't understand the question or comment from the Italian.
Oh, I see.
So they also know who had a headset.
I see. So not only for the speaker, but the venue staff receiving audio management is also very important.
Yes, I think so.
Yeah. Thank you very much for your very educational presentation.
Any other questions, probably?
Quick one. Doctor, fantastic presentation and fantastic work. So getting doctors to do some technical work is the motive of this presentation.
Yes.
So what motivated you to do that? Because if you know particularly what motivated you, probably we can replicate that in the other doctors.
So to tell the truth, I just moved to other hospital. So to tell the truth, they have to do themselves, but Dr. Saito want me to help them, even if I move to the other hospital. So I recommend as a doctor to know how to manage Zoom. It's not so it's difficult, and so once how to know once they know how to connect or using Zoom, so they can perform such kind of internet live demonstration. So I think so it's really difficult, but so I hope they get motivation after am I moving?
Yeah.
Okay.
As a technician, I envy this actually. But have you done any translation using more than 2 videos?
Yeah.
Like now, what you showed is the endoscopy and the room camera.
Yeah.
Anything like when you go to the big ERCP procedures, you may need to have the X-ray, like fluoroscopy.
Yeah.
Yeah.
So far, it's very difficult to share the fluoroscopy and such kind of image in National Cancer Center Hospital. So because a radiologist doesn't know how to the output. So so that's why we should get the engineer.
Engineer.
Yeah. So it's very important. Thank you for your comment.
That satisfies us.
Yeah.
Okay. Only one last question from
Yep.
yeah. This is like a what if scenario. I think that in your presentation you have like training for the first time. I think you need the preparation.
Mhm.
Yeah. And what if scenario is on your preparation, if you cannot fulfill the requirement, what would you do? A, you hire an engineer, or B, you tell to your boss, oh, this is the quality that we can do.
Mhm. So to tell the truth, I worked in a Kyushu University hospital before. So the lot of engineer taught me how to internet, how to connect. And 3 years ago, we performed the live demonstration. We connect with Russia. So I think experience is very important. So first, we should do by myself. I think. So, and of course, there are a lot of problems. So in such case, so I ask the engineer who knows such kind of issue. So I think, of course, it's easy way to employ to get the engineer, but I think it's not so easy in Japan. So and so first we have to know what should we do.
Okay, applause for Dr. Yoshinaga for a very impressive
Thank you.
presentation. Yeah, previously we heard from this floor that this is we need to settle a training program for this, and we need to do a need assessment to who that we can target the participant of our training, and we have heard that from the previous presentation, we can target the engineer, we can target a medical doctor because we have very different readiness in each facility. That's why we here also want to hear more technology to be explored and as a part of our training program in the future. And one of the interesting approach is how to set up 360 degrees camera for endoscopy live demonstration to have more visual and more interesting experience, especially for the medical student or for the doctors who participate in the training. And here, Yukiko Hisada from Kyushu University Hospital can share your experience, to conduct this. Please, time is yours.
Thank you, Dr. Arya. Okay, today I'm going to talk about course objectives for 360 degrees video on-demand transmission of operation room. It's part of CRICO's project. As most of you know, I guess, we TEMDEC have been trying live streaming using 360 degrees camera. This is a picture of 360 image opened on a flat surface. It was taken at Sakura Science at the beginning of this year. There you can see two doctors in 360 camera image and web camera image. This is also endoscopy image can be seen here and okay. Okay. This is 360 camera image and web camera image. And this okay, how to view 360 images? There are two ways to do this. One is to use head mounting display. The other one is to view on something like YouTube. By using head mounting display, you can view the image all around you as if you are there. This is overview of the distribution and viewing. Just one example of very, very simple diagram. This is how I was doing so far. 3 camera images were put into one laptop. By using OBS, picture-in-picture image was made and streamed on YouTube. You can see this streaming by using Oculus and also by PC monitors. Now, there are some things we are changing. In this project, we changed to on-demand instead of live streaming. Also, we changed to operation room from endoscopy. It doesn't mean that I'm not doing live streaming anymore, no endoscopy. We still do that. But for this project, we decided to focus on on-demand transmission of operation room. There are, okay. These are the course objectives that we have made. Now I will talk about these objectives, why they are important. First, create a configuration diagram for 360 video on-demand transmission. When you plan the web conference also, what do you do at the beginning? I guess many engineers will make the configuration diagram. To tell the truth, when I started working at TEMDEC 2 years ago, I didn't know about configuration diagram. I was like, what is it? Yeah, I learned in these 2 years. There might be same as me, new engineer. So first, we should learn how to draw. Yeah, sorry, yeah. Yeah, how to draw configuration diagram. For instance, this is our diagram that I made for ATS tomorrow. Yes. You need to plan which camera to use, audio, laptop, and so on. Tomorrow, I made it very complicated. Yes. And for this project, of course, 360 camera is most important part. What about the others? You might use two web cameras because doctors standing far apart, or there is some special machinery and tools that need to be brought to attention, or you want to capture a special technique of doctor. You need to decide how many camera and what kind of cameras and audio system you use. Second, retrieve sufficient quality image from 360 camera. At the time of this image was taken, unfortunately, quality of image was not good. After this, we have verified this issue. We concluded that it was due to unstable internet and dark room. Stable internet, room light, and a well-performing camera are very necessary. And overall, the most important thing is to set them up correctly. Third, input the demonstrator's voice with appropriate quality. It is not easy to pick up the voice of the operating doctor and deliver it. A pin mic may be necessary, or a strong directional microphone may be needed, or a noise canceller may be needed. And you need to be able to handle it. Fourth, record and mix in 360 videos. You need to stitch images and sounds. The appearance of the image will completely change depending on the position at which they are stitched. Fifth, publishing on-demand 360 video. Currently, publishing to YouTube is the easiest and most visible way to see it. To do that, you need to do some settings. Set up for 360 image, set up for 360 image, decide the range of viewing, and set age restrictions. Sixth, set up head mount display is a kind of tough part. And seventh, predict and eliminate security risks such as inappropriate exposure of patient information and age restrictions of viewers is a part you need to be carefully considered. Thank you for your attention.
Okay, do we have a question from audience? Yes, Mr. Zahir, please.
Okay. Okay, thank you for the excellent presentation. It's more like a comment. It's more like comment. To improve transmission, for example, for live transmission, especially in terms of quality, because I think we had done many events last time, and we noticed that if we use the same account for sending and receiving, for Zoom, so the quality for receive will be a bit low. I don't know what happened, but after we are using two separate accounts, one for sending and the other one for receiving, so it does help a lot, and we can achieve both HD quality. Last time when we used same account on the same computer, so sending is okay. I mean, other recipient can see a very good quality, but when we receive back, usually it happen when we have OT to auditorium. and we also transmit to the rest of the remote participant. So it happened like that. So when you use two separate accounts on two different computers for sending and receiving, it does help a lot. Zoom account, and one of the Zoom account we also use for stream to YouTube. So it does help. I'm not sure whether other experience this kind of issues or not. Yeah.
Thank you so much.
Okay, yeah, because we are running out of time, so we need to move to the next presenters. Thank you very much. Applause for Yukiko Hisada. And then, okay, this is another future innovation that we can empower to be trained in our future training. The using of MetaVerse platform for remote surgical education will be presented by Mr. Shintaro Ueda. Time is yours.
Okay, thank you, Dr. Arya. Okay, I'm Shintaro Ueda. I'll be talking about medical case conference using Metaverse. Okay, let's start. Okay, what is Metaverse? Okay, Meta, former Facebook, defines Metaverse as the next evolution in social connection and the successor to the mobile internet. That's a big definition. And Metaverse can be any 3D virtual space powered by technologies including virtual reality, VR, augmented reality, AR, artificial intelligence, AI, and the Internet of Things, IoT, and blockchain that allow people to interact with each other through avatars. Okay, I would compare the internet with Metaverse. First, the internet. As all of you know, it's a place for storing and sharing information. Its users generate about what happened in the real world. And next is Metaverse. It's a virtual world where its users live their virtual lives. The keyword is virtual. The activities happening in the metaverse and the data it stores may not have any connection with the real world. So to compare, the internet is an extension of the real world, while metaverse is a virtual space which that exists in parallel with the real world. So let's mix up metaverse with telemedicine education. First, doctor-to-doctor telemedicine education activities are efficient for sharing knowledge with a diverse and large number of participants. And due to the widespread of virtual reality metaverse technology, the need for immersive telemedicine education is increasing. However, existing video conferencing platforms lack liveliness and interaction in the sense of being in the same place, share information through gestures and body movements. So will the integration of Meta Workrooms, Verbula, both metaverse platforms into the telemedicine education change the telemedicine experience? Okay, here's what we've done at TEMDEC. It's the example of conferences using Metaverse. We carried out online video clinics on minimal invasive surgery. First, using Meta Workrooms. Next, using Verbula. Participants were surgeons from medical institutions throughout Kyushu, Kyushu Island. And participants discussed the surgical procedures shown on the screen. And most of the video were procedures recorded by surgical procedures of junior surgeons. And the senior surgeons gave advice or directions to improve the procedures in the future. So it's a very educational purpose. Okay, 2 to 3 presentations were given during the conference, and all presentations included still images and videos showing minimal invasive surgery. And for workrooms, The participants can join the workroom by Oculus, the head-mount display, or by the web browser on the computer. Okay, here's the viewpoint from Oculus. The participants are shown as avatars, and the video clip is shown in the front of this using the whiteboard. And on the left side, you can see the participants joining from the web browser. And for the immersion effect, for example, if someone's sitting next to you in the virtual space, for example, sitting next to the left of you, the voice will come from the left side as if there's really someone sitting next to you. I'm sitting to the left of you. So it's very immersive experience. And also hand gestures are reproduced in a real style. And here's the web browser viewpoint. All avatars are shown. Okay, another web browser viewpoint. As like Zoom, the shared image is shown and the participant's image is shown. Okay, this is an example of Verbula. The participants joining through the Verbula application are shown as avatars. And next, we created a large conference room because there were multiple participants and we have multiple screens because there were multiple presenters. Okay, let's go back to Critical's project. These are the objectives of metaverse training for telemedicine education. First, there's to prepare metaverse application. Second, create a common workspace. Third, share medical contents. Fourth, use annotation. I would like to go through each one. First, for prepare metaverse application, as if all applications you have to prepare. And so you have to download, install the application. Then you have to create an account and log in. Next, create a common workspace. You have to create a workspace that all participants can join and you have to announce it. And you have to create the workspace according to the number of participants you are going to gather. For example, for a large group, you have to prepare a large conference room. And for a small number, you can just have a small office, a virtual office. So next is sharing medical contents. As you all know, through telemedicine conferences, we share medical contents and there will be still images or video clips. So we have to share these in a high quality fashion. And last, use annotation. During discussions, being able to use annotations is very useful. For example, using laser pointers. And for newcomers, you have to explain how to use these annotations. So you have to be prepared to explain. And this is all for the objectives. So I would like to have a discussion about the objectives or metaverse in general. Thank you.
Thank you, Dr. Suntaro Weda. It gives me a nostalgia about when our meeting here discussed and introduced to Zoom. Do you remember, everyone? Then Mr. Chiang, yeah, introduced Zoom. It was like a long time ago, before COVID, and then Zoom, and then COVID happened, and then Zoom blew up. But we already know about Zoom before that, and then we introduced to the new platform again, Metaverse here, and I think we need to be ready with the development of technology here, the innovation, and we are open to the discussion here. Anyone from the audience?
Okay, I will so keen to know about more about the metaverse, especially in terms of the platform that you are using. May I know that whether this platform is totally free or you have to subscribe or you have to buy the software?
Okay, we use two platforms. One is Meta Workrooms. This is free. And another is Verbula. This is you have to pay for yeah, they have monthly payments. Yeah.
Oh, they have monthly payment.
Yeah.
Then, you can. Is it based on account or how many?
Number of participants.
Oh, how many participants you can create?
Yeah.
I can imagine that if we have a ATS later on, where everyone
That's actually something that I would like to do.
in the
Yeah.
metaverse platform. So it's quite interesting. Never mind, that is my thought on it.
Yeah, yeah, there are a lot of free platforms. So we tested about 6 platforms, but after considerations, we started using Workrooms and Verbula.
Thanks for sharing. Right. Anyone else?
So
Just additional comment to the Zahir. Actually, last APAM, it's not the last, but in the COVID-19, APAM Nepal used this Barbera. Yes, you remember. And at the time, the many participants invited, and yeah, avatars of the participants come to the Barbera venue and have the parallel sessions. Yeah, quite interesting. And at the time, the EPAN have the sponsor from the Barbera. So yeah, many of the fee were covered. Just information.
thank you.
To have that audio, you said the audio is divided, left is left and right.
Yeah.
It's inbuilt in the software or it's
Actually, that's a feature of having the head mount display. And yeah, for example, if someone on the left side talks, you hear the voice from the left side from the head mount display.
okay.
So it's the hardware.
Okay. My question is, to the new device, you need to assess whether your participant is ready to know that, to use that, and how to make sure that your participant is ready, because sometimes, yeah, you need to check is there any preparation before, or maybe they need to use the head mount. Is there any experience that you have before?
Like any other new technology, there's always a training phase. So people first time using head mount, we had to go through the steps together. And so there's always that procedure.
Okay, so is it difficult? Is it difficult or?
No, it's easy to use.
Is
Just, you have to just learn a couple of steps.
Okay. So we can do that in the next session, yeah?
You might be able to. Yeah, no, yeah. It's always, do we have enough budget or not?
But head mount is a must, isn't it?
Yeah, for some platforms, yes. But for Meta Workrooms, using the head mount display or you going through the web browser, there's 2 ways.
Oh, you can do the web browsers. Okay.
But there won't be the immersion effect.
So the other experience that you had, the benefit of using this metaverse in the learning experience, in the learning advantage. So what is it? Despite the you have the sense that you are not there, but you are you have your avatar is there together with the other avatar. But in the sense of learning, what is the benefit that maybe you can share?
One interesting thing is if you have an avatar in the virtual space, there's more discussion, there's more conversation. That means more talk about what's shown on the screen. And so more education. So, and the younger doctors are able to talk to the senior doctors without any barriers. You know, face to face, maybe they might be a little shy, but through avatars, that barrier is gone. It's a, yeah, it's amazing. It is. So
I can imagine how about the if someday Metaverse joining with the AI become a one avatar can answer anything. I think it's a little bit creepy, I guess.
yeah, that'd be funny. Yeah.
Okay, any other questions from the audience? No? For that, okay, send a big applause to Shintaro Ueda. Okay, so I think Mr. Shintaro Ueda close our presentation session, and then we will have like we will have a discussion, and we will discuss how we will develop the e-learning training module. Yeah, actually, some of the question has been raised by Mr. Sisira. Yeah, previous to that, what of the important aspect like the need assessment, who is going to be the target? Is it the medical doctors or is it the engineers? What kind of skills? So, and then, yeah, we also have like learned that in so many occasions, the medical doctor themselves do the live streaming. Yeah, when so yeah, that's something that we can discuss in this session. And the committee already prepared the what do we call it? The snacks. Yeah. Oh, that there. So we can have like easy discussion while you can enjoy your snack here. Just like make a cozy discussion. So I think Prof. Kuriko want to delete what is the flow of this discussion, please, Prof.
Thank you, Dr. Aria. Nice the introduction. So thank you all presenters and the participants for nice hot discussion. So now in the discussion, we would like to discuss about the objectives for each topics. So I think that our staff send this data to online participant and the venue. In the venue, we have same data. So it summarized 4 topics, 5 topics: overview, setup, venue for hybrid medical conference, and live demonstration, 360-degree video on-demand transmission of operation room, and metaverse medical case conference. And the draft idea is here. So if you have any question, comments, or suggestion for each topics regarding this course objective, we are very much welcome. So yeah, please. Please use my microphone.
Again, just to emphasize the importance of store and forward component. I think this is pretty much focusing on the live sessions face to face, but this is all my personal, not having any experience in the in this project. So therefore, I'm just looking at from the stranger's perspective, outsider's perspective. But I would really, if I am the one who is going to take this course, I would really like to have both live experience as well as non-live or store and forward. That would enrich the program. But that's going to be only one very small component, but very important to me.
Yeah,
I think.
yeah, thank you very much for a nice comment. And yeah, the comment from the different area is really important. And actually, the store and forward element is not in our topics. That is this on-demand transmission. So this is we also think that not the so not for only for the interactive, but the on-demand video store and forward and is also very important technical elements. So we review these topics and for make this kind of balance, we may make the video on-demand transmission of operation room for 360-degree items. So it's the different compared to the live medical transmissions. Then also we thought this, we checked these 5 topics and think the balance of the medical subspecialty. So we set the medical live demonstration as endoscopy transmission as one of the medical subspecialty. But I think this technology can be used in another field, surgery or radiology, or if we connect many other medical equipment library. So we set the live medical demonstration, and but the case is the endoscopy live demonstration. And also for the 300-degree video transmission, on-demand transmission, Yukiko have experience of endoscopy, but in these topics, we set up surgery because the endoscopy room is dark, and also not many staff work together on each endoscopy, but surgery, it's done in the bigger room. Many staff work together. So we set the surgery in 360 degree. Yeah. So thank you very much for a nice comment. And okay, and please.
Yeah, in continuation with Mr. Sirisa's comment, the store and forward, like a lot of data is available on the web, the YouTube, and information is available. But the medical students or practitioners are not very keen to go through this data. And it is live, it is for the specific time, and they have to attend. So that shows the importance of that program. They wanted to learn that particular time there. So I have one example for this. We conduct this student classes to one of the medical college in our place. So every Friday there will be one surgical class, 1 hour class that is. So initially, because of our busy schedules, we informed them we'll record and forward. The attendance used to be 10%, 15% of the total students. So then we realized we converted into live program. Attendance is full. So as soon as you say record version, then the interest is not so much for them to learn. And when it is live, it depends on the expertise also, who is speaking, who is performing the procedure. So the attendance part will be more, the learning, we can reach more people.
So you mean the variety of technical usage is really important for the variety of the application when it's including the student education.
Yeah.
Yeah. Well, thank you very much. Yeah. And I myself noticed from your presentation some important topics is really needed to add. For example, through Tunguru presentation, now the Tunguru part is set up big venue for hybrid medical conference, and I items are only these these items, but he explained, he in his presentation, he mentioned about the management of multiple camera or mixing multiple image is important. And also showing the camera image to the display or this kind of management. And to set up the big venue, he introduced the long signal change using the LAN, local area. Then, so this kind of the controlling the very big venue, the signal control the very big venue is also important. And also the staff management in the big room and the parallel sessions issues. So yeah, I think these kind of issues should be included, this hybrid big venue. Now the items are really basic, using network, operating video system, video conference system, audio visual equipment, and the setup venue, and maintain quality. But yeah, after I hear your presentation, yeah, maybe we need more this kind of management of complicated image source or management staffs. Yeah.
I agree with you. After Tunggul presentation and look at this, I talked with Tunggul. Is it possible if add some topic like previously in the presentation, Tunggul told about OBS, or maybe there is another platform about that, and also how to manage, how to make a team, coordination team, at least there is how many team in the field. If you want to set up a big venue, I think it will be good if in the topic set up big venue for hybrid medical conference.
Oh. Yeah, I agree. So thank you very much. And any other ideas? Any topic? Okay, yeah, please. No, sorry. Please give us your ideas.
No, I'm just very curious. As you can see, because this is a great job, great opportunity in terms of medical education, developing digital health education. I was just wondering, is there a value of adding a component on live video consultations? This is focused is more about surgery, more about image-based training at a distance. Now it is becoming very, very important for doctors to use video for remote consultations. You know, and there's nothing in the world at the moment, no education whatsoever. But this is going to be the next important thing, doctor calling or the patient calling the doctor, wanting to talk about his heart problem or a neurology problem. And then certainly the conversation will involve different things. And these consultations are now been happening, you know, in physiotherapy, speech pathology, all these sort of things. But training as such is not really set up. So this is an opportunity for doing that live video consultation as a component. And alongside that, how to utilize electronic medical records, electronic health records for optimizing those consultations. That would be a great value to this work.
Thank you very much. So as you mean the doctor live video consultation, and sometimes the image input would be the EHR or so I think this topic is really important, and we would like to think about adding this topic. Actually, our topic, one topic for hybrid medical conference. That means that including a consultation. But it's focusing only the setup big menu and not included the connecting the EHR or the video quality or so maybe we will create the different items or add this your point consultation element into these items.
Yeah, I think, yeah, I could notice that that is in there, but very precisely, if you could just elaborate, not only the technical part, but also the skills part. You know, there are certain skills for doctors needed to do a proper consultation, you know, like bedside manner, you know, in real time consultation, you know, the doctors should know how to do the proper bedside manner. Similarly, now it is becoming very important to have website manner. You know, the doctor using properly the video and how to sit, how to talk, how to communicate, all these sort of things, you know. So those are, I think, important.
Okay. Do you mean the bedside manner is dictated to patient or yeah?
It is an example. It is an
An
example. Yeah, it is
example.
an
I
example.
see. Okay. I see.
I totally concern. I totally understand the concern or the issue raised. I think probably I just want to share when before we start our teleconsultation project, I think we have done a lot of homework or research basically, especially in terms of medical ethics and also in terms of medical legal issues that probably comes whenever we start this project, especially on the insurance coverage and also how basically to train the doctors how to what you call consult patient through remote. I mean through the telemedicine platform. So it involves a lot of things. For example, how to access the patient information system, and to what extent that we can share the information between doctors and patient. So, for example, like I mean, using the platform that we have built, we can share the lab result and then explain to the patient on the reading of the result, and also we also can share the PACS images or radiology images and explain to the patient on the image itself. So we had developed something like a procedure, and also we had developed something like a guideline, at least for the doctors, junior doctors, especially the medical officer, to consult the patient. And from photo that I shared before, there is a consultant at the back. Basically, will oversee the session. That's why our telemedicine for doctor to patient is happen at the clinic, where the consultant can be there physically, basically to monitor the consultation session. So probably that is my comment. So probably we also can include, if possible, under this
syllabus.
Under this project also to see on the aspect. Yeah. So
I have a question, Mr. Zahir, that yeah, sorry. So in your case, the teleconsultation skill is an obligatory module that apply to doctors that practice there.
Yeah. During my initial presentation, I mentioned about the course module under psychology, where every doctor who want to practice telemedicine, they have to go through that module and they have to pass. They have to pass, I think, 90% in order for them to be certified to conduct teleconsultation.
I see.
So they will issue a digital certificate that they already gone through the module lah.
So they get the certificate for that
Yeah,
teleconsultation module.
Yeah. They have they once after they pass and get the certificate, they can do the telemedicine teleconsultation session.
But in that module, it's only the way that they do the teleconsultation, the skill of communication. But is that also include they need to master how to create set the devices or so? No.
It's just how to handle the what you call the apps only.
Okay.
Yeah.
So that's something that I want to emphasize here. Our module here is created or developed for the engineer or for the medical doctor. I think probably we need to have like a clear distinction between, because again, this is about the need assessment. If we train it to the medical doctor, probably the need will be different. Like the reconstruction is very important.
Yes.
Yeah. But setting live endoscopy, I don't know. Yeah. Yeah. But for the engineer teleconsultation, I don't think it's not relevant for the engineer, but for them, the technical things like this.
Yeah.
But there is some gray area, like for example, the metaverse, yeah. But maybe the skill of the skill of competence is different. Maybe the doctors only need to know, not to the skills. Yeah, yeah. That's something that we need to prepare too about the knowledge and the skill.
Yes.
Because as a medical lecturer, for having the module master until the skill level, that's a very long step
Process, yeah.
long process. Yeah. So we need to have a very developed, very planned step by step from the knowledge and then from the process and the skills, and not to prepare the assessment, because assessment of knowledge and assessment of skills is very different. Yeah. And I understand also that if we want to, okay, that's about the process of the module, yeah. And we also can create this module using hybrid or online, like synchronous or asynchronous, if you understand that, if you know that term. Yeah, but I think if you want to reach more participant, if you can create asynchronous, everything is recorded. Maybe for the knowledge it's adequate. But for the skills, yeah, I think, I don't know if we want to assess the skill, is there any approach that we can do here? Because if skill, for example, we need to ensure that the students or the participant can demonstrate. For example, if the skill is about cooking, they need to record, they cook something.
Yes.
And then they demonstrate it and record it and send it to the professor, and the professor will say that, oh, your method is correct. So what about these skills?
Yeah, I'm agree with you. It's very different to develop education and knowledge and also skill. So actually, I have a research about that. Using the online platform, it can improve. The conclusion of my research, using online platform, it will be increase the knowledge, but to assess the skill, it's not different between we give the skill education or not the skill education. The skill not so different, but for knowledge, they will improve the knowledge. But during the pandemic, we assess the skill of the student because we have to assess their skill. So maybe it possible or not. So at least they have to make a video, yeah. So make a video like how they develop online setting the big venue or maybe setting for endoscopy. So at least one, because if there is a three courses, and they have to make a video for single thing, maybe it will be difficult. So at least to assess their skill, at least they has to make at least one video to so we can so we know oh, that people already can do by themselves. It's my opinion.
Okay, and thank you very much for a nice discussion. And Pramod-san, thank you very much. Please make comment, question. You are muted.
Hi, namaste. This is Pramod from Patan Academy of Health Science, Nepal. Yes, nice to see you all. And I have a comment for development doctor to doctor telemedicine training development platform. Yes, suppose TEMDEC can make a policy over all nations or for Asian regions, and like that in the training program there should be provision to teach how to develop in-house policy. In-house policy development for the doctor-to-doctor telemedicine activities. It makes after develop if the institution, suppose Patan Academy of Health Science made a policy, we don't have any policy for telemedicine or doctor-to-doctor telemedicine. We take a guideline from the TEMDEC. Sometimes it depends on the leadership. If leadership wants, then those activities will run. If the leadership is not interested, then the that services might stop. So to continue the services, I recommend, I comment for the policy in this regard. Thank you.
Thank you very much. How to make the in-house policy?
Yeah.
Very
Application.
very difficult. But yeah, we needed to think more about discuss within the team.
I think Sisira want to add something.
Just to add a few ideas to keep coming. I think if we go back to the objectives, I think objectives should lead to the outcomes. That's the knowledge, skills, and competencies. And then you look at the what are the level of knowledges or the components of knowledge we want to develop in the participants, and the skills and competencies that will lead to the content and to the e-learning platform that you are going to use. So that's all going to fall into place. So I think the main emphasis should be, of course, objectives, and objectives. We get the objectives right, then it will fall into place. I think all the other things will follow. Knowledge, skills, and competencies. Yeah, I think that's. I'm just dragging back to the objectives because that is important.
Yeah, but very nice comments. And first we decide the topics, and each topics through the training program, the trainees will get the skills and knowledge, that's competency through the training program for D2D telemedicine conference and consultation. So Yeah, very nice point. Yeah, that's the key of our aim today. Yeah. Yeah, thank you very much. And after the discussion with Shishira Sensei and Arya Sensei, Zakir, we include the remote consultation as a main topic, but we did not mention each topic in a remote consultation as one of our topics. But I noticed that University of Malaya, Zahir have the many knowledge for experience, and also his center give the training for doing this. So maybe we just discuss to add this point or embed this element in the items according to his experience. Yeah. I hope. Yeah. Great. Yeah. And today presentation is really nice. Based on your activities, many points appeared. Yeah, we missed. And I also find the important point in the live demonstration. If I can show again in this session. Okay, come. So the live demonstration have these 7 points. But I think we missed the point of the Dr. Yoshinaga said. The technical person needs to focus how it will be shown, how our transmit image is shown in the actual venue, or the picture-in-picture technology, or some sound management. We should manage the sound not only for the live demonstrator, but all of our another staff in the venue on the operation site should hear the sound. So this kind of good management is important, and the training program should provide this kind of knowledge. Okay. Any other comments, question? Yeah, please, Jian-san.
Yeah, I when Dr. About talking about we don't need the engineering, I was very shocked. I said, gosh, well, gosh, we we are lost our job. But I feel it's good because when the technology is improving and advanced, really, the many people can do many good things because the technology help people to manage things easily. So for example, now in your case, you face the problem. I think I always told the engineer and the doctor, I said, there's no poor learner, only the poor teacher. For no poor user, but the poor designer. So we need to educate the designer, say what's the problem we got, and you need to improve your device or your So it's very important for us to have a dialogue among the user and the designer. So I really, for one day maybe we can invite the Zoom, since we use Zoom a lot. Invite the Zoom designer or the engineer, have a dialogue for the end user. I think they don't know what's the problem we face. They may be quite satisfied with their achievement. A lot of people use it, but we have some special user. They need this technology, and we can help them. For instance, I really admire you. You can do that. Actually, we do have two cases in my experience. And you are talking about teleradiology. In one instance, we have a conference, and suddenly we realized we forgot the the fluoroscope. We need to watch the fluoroscopy. That's a fluoroscopy. We didn't adapt the proper adapter. So someone took his mobile phone and shoot the screen. It's work because nowadays your mobile phone is amazing things, and even the pathology. We also have some experience. We also forgot the pathology imaging. People want to view it, and pathology is microscopy. And if you have a good adjustment, you still can catch up the image from your mobile phone. So that's that's a beauty for the now technology everybody can be on project. Also, sometimes a doctor, they are doing the operation and you need people, we have a different camera to shoot the image of the operating site. But sometimes we need to see what's the major operator, the chief surgeon, what he look at. So if you have a camera next to him and next to his eyes and shoot, then the learner can know, oh, what he's looking at. And that time you just take your mobile phone next to him. Yeah, I don't think it's a head mount camera is good because when you know the viewer will, they get headache because of that image. Because but some static image provide more information. And now everybody can provide the image with now like a Zoom. So I think we just need your what's your difficult what's the problem you face, and we get someone to help you solve. I really hope one day maybe we lost our job, but we are doing some other things. But you can. We will make you busy to do everything. I'm kidding. Thank you.
Okay. Ms. Chan, interesting feedback. So I also feel the same. I mean, after we had gone through many years from DVTS plus, video, and then now Zoom. So I found out that after we was introduced by Zoom, and when pandemic came, and post pandemic right now, so I think Zoom is help us in many ways, especially like when we conduct last time for doctor to patient, where we are using nurses basically to doing the support. And since Zoom application is quite simple, with built-in echo cancellation and very easy to use. Even patient also, we just train them for about 5 to 10 minutes only. They know to click the link and there they go. I mean, the mic and camera is automatically. So I think in terms of technology, like Mr. Chiang said, it's helped a lot when we have this Zoom platform. So I think probably the engineer will focus more on the large conference or maybe for handling more complicated setup or more advanced equipment. But the normal meeting that we have for webinar now, for my situation, the nurses and the staff, non-doctor, non-IT people also can do it by themselves. So I think probably we have to see some of the content that we have to readjust in terms of the skill required for the engineers. Right, that's my comment.
Yeah, I think this small room setup, like big conference setup that Tungal was talking, the small room setup for doctors, it is very easy. So why can't we come out with a small material on this, like small room setup using laptop, the video capture card, and the OBS. So that can help us in reducing the cost, the live transmission. One room, 2 videos, one endoscopy or laparoscopy image, other room camera, and the audio. That makes everybody's life very simple. Every institute, whoever is planning to do this live transmissions, will have a IT person definitely. The IT person can help with the OBS, and that is very simple. The setup is simple, and the audio quality is very good in that. And we have the small audio switchers with the 2 mics. That would serve definitely.
Yeah, thank you. Actually, this now the current items of live demonstration not include the parallel connection, but maybe if already I noticed that the Dr. Yoshinaga managed a different room, so yeah, we this kind of parallel management in the very easy setting should be added. Yeah, according to your comments. And I noticed that the Chian-san's experience for the mobile showing using the mobile. Yeah, and Zahir's experience for the short training for the staff, students, also really important, aspect. Shishira Sensei, do you want to say something?
Thank you. Thank you. Another idea. No, the discussion is really stimulating. It's really good. So we've been talking about different components, different aspects that we need to focus on. I'm dragging you back to the objectives. And I was thinking in terms of the whole project, having a very sound pedagogical framework would be really helpful. There are many number of those frameworks because this is all about developing content, curriculum for 2 different kinds of audiences. One is for technicians, engineers, and for the doctors, clinicians, those who are practicing. So certainly the objectives are going to be very different. Accordingly, the content is going to be different and the delivery methods may also be different. And also the way that you are going to assess their skills, evaluate their skills also going to be different. Therefore, having a good framework, pedagogical framework would always bring you back to that. Are we doing the right thing? Are we doing the, so I think that is very important in the very beginning. We know what we are trying to achieve, and also according to this framework, we are ticking the boxes.
I see. Thank you very much. So you mean that you mentioned that pedagogical framework is including the very different topics and items together.
The pedagogical framework will give you a systematic process, how to proceed with the development of curriculum. That's the framework. So that what are the knowledges we want to develop, skills and develop competencies for the engineers, for the doctors. So so you can place the objectives accordingly in these 2 groups. I can't really sort of tell you what framework, but there are many number of frameworks available in the pedagogical world. I can even email you later on some of the examples, but there are very sound ones available. And that will also raise the profile of the project as well. When you write it up, it's all based on very academically, systematically.
Thank you very much. We needed to, think about this. And also, this kind of framework should be explained in the overview section.
Indeed.
So I think in, practical style, for example, teleconsultation or teleconferences or different subspecialties, surgery, endoscopy, or different aspect of the technical, the on-demand or live. So maybe this kind of different topics should be summarized in the this framework.
Yes. It won't be too hard to do that. Once you have the framework, you will see, how we are, it's just a matter of ticking boxes type things, frameworks are for that.
Agree. I think Mr. Sira is summarizing everything now, yeah, with the concept that we need to have like a pedagogical approach in here, because if we see the whole syllabus here, it can work like a diploma postgraduate certificate for those who who join this. Yeah, yeah. For that, I think I agree that we need to be very clear with our objective, learning method, our assessment method. Yeah, and agree that he said that ticking it means like a prioritizing. Yeah, which one that we want to start first. Yeah. From the engineer or maybe for the doctor, we can do both, but it will take all of our energy if we want to create both module in one time. So I think prioritizing is one of the thing that we need to decide to. Yeah, yeah, because here we have a complex syllabus here. Everything can be important, but then back to again our need assessment, our target, our priority. So which one that we develop for develop firstly. So I just want to remind you about the time. So do we still have a time? Yeah. Yeah. Actually, that's already summarized everything. Yeah. Yeah. Because I just want to, I bet you already know about the sayings, the word that what doesn't kill you make you stronger. And I think we are here that the strong people are here who struggle and survive through so many storms. Yeah. And now we are going to be another pioneer, the pioneer of creating a new modules, yeah, for the engineers. Yeah. But like Mr. Chuang said that it is not the user who has a mistake, but the designer. Us, we are now the designer of the module. So we need to design this module comprehensively, and maybe we already compile all of the important things, important materials, important competency. But let's go together then to prepare the details, yeah, of our modules, the learning outcomes, the competencies, the delivery. Yeah. Now we also have in the pedagogical aspect. Now we also can involve the technology. Yeah, whether we want to use full online or hybrid. Yeah, in the learning method. So that's one of the things that we can decide later. But we, of course, we are now survive because we are collaborating each other. So I think this collaborate must be maintained, and I think this module will be much stronger if we combine we collaborate as a TAM deck, and the whole institute inside is participating in supporting this module. So it will be well recognized as an international module. I think that can be, hopefully can summarize this evening session. So I think that's all. Thank you very much for a very fruitful discussion this evening. So I hope that we will look forward for the next step, yeah, Prof. Kuriko, for the development of training. And yeah, we can have all of the method of meeting to discuss the next preparation. I think that's all for this evening. Thank you, everyone. And any additional, Prof? Ah. Oh yeah, we will take a picture of the session. So I hope all of the online participants can turn on your camera. Yeah. So we will have like hybrid photo session here.
Okay, please show yourself. Yeah, we will take picture. So please. One more picture. 3、2、1。Okay, so thank you very much. So thank you very much, all friends, and yeah, see you tomorrow. Tomorrow is main session. So yeah, thank you very much. Wow, Min-san. Yeah, Dihan, Dr. Balbi Marcelo, Dr. Akusa. Do we pass key? Oh yeah, you want to say something? Yeah. Yeah. Chiao-san, you can.
Halo Minsan, Dr. Aksa.
Hello, Dr. Arya. Sorry for not coming.
Wow, Aksa Sensei, I want to, I miss you in the venue.
I will miss you too, everyone.
Thank you very much.
Okay. We just say.
So see you tomorrow.
See you tomorrow.
Bye.
また明日。皆さん。